Hello, good evening. This is Labakcare Organization's production. Mrs. Labakcare, Dufa Davis speaking to you tonight. We are continuing on our current topics in preventive health, and we've been talking for this month on cardiovascular health. So tonight, we're going to be talking about stroke. Stroke is medical emergency. Should you have any of the signs and symptoms we are mentioning, please seek medical attention right away. The earlier you get to the hospital for stroke, the better the outcome. The better treatment you get, the better is the outcome. So, what is stroke? Stroke or brain attack occurs when there is disruption in blood supply to the brain, either by a clot or by rupture of the blood vessels. Clot in the brain will disrupt circulation of blood and oxygen to the brain. Rupture blood vessels, blood will cover one area of the brain and there will be disruption in circulation of oxygen and blood to the brain. There are two major types of stroke. We have hemorrhagic stroke and ischemic stroke. An ischemic stroke is when a blood clot blocks the blood vessels and deprives a particular area of the brain of oxygen and blood supply. Ischemic stroke is the most common type of stroke. Then we have hemorrhagic stroke. Hemorrhagic stroke occurs when an artery in the brain breaks or bursts open or leaks blood. Hemorrhagic stroke is more fatal than ischemic stroke. Every minute and 14 seconds, someone somewhere in the United States dies from stroke. Every year, more than 795,000 people in the U.S. have stroke. Stroke is the fifth leading cause of death for all Americans, and it's the leading cause of serious long-term disabilities. Stroke is the third leading cause of death for women. Why? Because women live longer. It occurs in people ages 65 and older. The first 3 days after stroke, listen to this carefully. The first 3 days after stroke occurs are the most important for recovery and survival of the patient. So, you're having any signs and symptoms, pick your phone, call 911 so that they can come and pick you up and take you to the hospital and get treatment. What are the signs and symptoms? You have face drooping, hand weakness, numbness, difficulty in speech. You are trying to speak, but we can't understand what you are trying to say. What are the risk factors? High blood pressure, poor diet, smoking, obesity. Those are modifiable risk factors. Even diabetes, because this can be changed. If you take your medication, you are eating good diet, you are exercising, you are not smoking, you have, diet modification and exercise are modifiable risk factors. And that's why I'm bringing this information to you, because there are some things we can change that will make us healthy. Non-modifiable risk factors, race, of course, as always, African American. Why? No good access to health care. No poor neighborhood we are living, and so much more, non-modifiable risk factors. Gender, women are less likely to recover than men. Age, the older people suffer more from stroke. Anxiety, depression, high stress level. These ones we can change. Genetics and family history, maybe we cannot change them. What's the treatment for stroke? Call 911 at first symptom of stroke. Emergency care, treatment to prevent another stroke, rehabilitation to treat side effects. Most importantly, modifiable risk factor. If we do what we are supposed to do, we are eating well, we are exercising, whatever we take into our body, whatever we eat, manifests in our blood system. Plaque that adhere to the arteries, narrow the arteries, and as a result, no blood supply to the brain. So, eat well, stay well, exercise, drink lots of water. Water is good for you. Water is very good for us. So take care. God bless. See you next week. Bye-bye.